Williams, the Mayor of Kingston, and also Mr. Keith Duncan, the President of the Private Sector Organization of Jamaica. We'll begin our press conference with the Up Minister.
Good evening, ladies and gentlemen. Welcome again to our regular Thursday COVID conversations. I think we missed last week, and we hope you were not too inconvenienced. We did, however, during the course of the week, provide information, updates, including a statement to Parliament on the state of COVID in our country. Interesting week. We announced the National COVID Commission, COVID-19 Vaccine Commission, and we will continue to provide updates around that commission because the prospects of having a vaccine in the new year are real, and we are preparing to ensure that we in Jamaica have access for our population. But that will be a conversation that will continue. We also announced the concerns in Westmoreland and Western parishes generally, and we're going to spend some time speaking with our mayors. The municipal authorities throughout the country have a big role to play during the Christmas season. They are on the ground, they are out in the marketplaces, in the shopping districts. They manage and influence permits, oversee, supervise the activities on the ground. There have been many announcements around Grand Market, and so we felt that it was important to get their perspective. They have been, through the Ministry of Local Government, Minister McKenzie, and the local municipal authorities have been very supportive in the COVID fight. We together will be even more necessary because of what the season represents. Today is likely to be, or will be, the final COVID conversation for the rest of the year. We will keep the public informed on a needs basis. It doesn't mean that we will stop speaking. Conversations will continue over the week. In fact, tomorrow we are doing a blitz across the significant town, every parish capital, with our community health aides pushing the mask up before you talk up campaign. So if you see them on the streets, in the streets, walking around, pushing the messaging, please, it's a reminder to all of us that we want to ensure that we have a safe season. But before we go further, I'd like to ask our Chief Medical Officer to give us an update on the last 2 weeks, showing the numbers and the concerns that we have as we move into the Christmas season. CMO.
Thank you, Minister. Good evening, everyone. If we look at the two maps, the first map shows the cumulative number of cases since we started having our first cases in March of this year. We now have 11,443 confirmed cases, and the distribution of those cases across the country is seen in the top map. At the bottom, we see where we have had 744 cases in the period November 25th to December the 9th, representing what has happened over the last 2 weeks in the country. Next slide. This slide tells us about the rate of infection, the number of cases per 100,000, first cumulatively, total number of cases, and at the bottom, the active cases. Very important to note that in the top map, overall, if you look at the southeastern parishes, that is where you will see the darker colors and represent what would have happened earlier also within the year in terms of the southeastern parishes being where we've had most of our cases at that time. But if you look now at the bottom map, you can see that the darker areas are in the northwestern parishes, which is where we are now seeing the most of our cases. Next slide. This gives the epidemiological curve for the country, the overall picture of cases each month. And as As you can see, we are now in December, and you can see that there is a slight increase in the number of cases. We would have been trending down. We peaked in August, at the end of August, and we would have been gradually trending down going into the start of November. But at about the middle of November, you would have started to see our number of cases going up. This, I want to remind you, was that we have predicted that we would be expecting a surge in the number of cases over the Christmas season and going into the Christmas season, with the increased amount of traveling that occurs at this time and just generally an increase in activity coming towards the end of the year. And this we expect that may go on into the early part of next year. Next slide. Here we look at our weekly positivity rate, and you will see that our positivity rate, meaning that number of confirmed cases per the number of tests that we do each day, you can see that there's a gradual, very gradual trending down in the number of, in the positivity rate, despite the fact that you will see that we have been making tremendous efforts to increase the number of testing, and you can see that our overall number of tests that we are doing each day have been increasing steadily, but we are still seeing a trend, gradual trend down in terms of our positivity rate. Here you can see more clearly the problem that we are seeing in terms of our overall numbers in the northern and the western parishes. We would have highlighted earlier this week that Westmoreland would be showing definitely an increase, and if you look at the left side of the screen, you can see that there is a gradual increase in the number of cases in Westmoreland. Similarly, you will also notice at the top of the screen, if you look at St. Anne, that there is a gradual increase in the number of cases. And also, if you look at Hanover and Trelawney, if you take out those little peaks that happened in between, you will see that there's a gradual trend up in the number of cases. Even in parishes like St. Thomas and Portland, which are to the right of the screen, even though the numbers are few, you will see that there has been a gradual increase in the number of cases. These two maps shows us by community what is happening, with the shaded areas representing persons that are affected within these communities. The top map would show that almost every community within the parishes and within the country overall have been affected by COVID cases. And again, we want to say that the number of cases that we see, the number of cases, the number of persons that are tested, the number of cases that we report are really just a tip of the iceberg. It gives us an idea of trends, but not every case is detected. Many persons don't come for testing. Many persons would not recognize that they are ill, or that many persons would not have symptoms at all and would be in the communities. The very fact that almost every community has been affected since the start of our first case would suggest that there is a potential for spread in all of these communities. Very, very important that every single soul maintain the infection prevention and control measures, because more than likely your community has been affected at some time, and there may be still persons within those communities that are affected. In the bottom picture where you see the active cases, you would see the parishes that we are now presently having most communities affected. And while it is that Kingston and St. Andrew and St. Catherine would always represent a lot of persons being affected simply by the numbers of persons within those parishes, you would tend to see those parishes featuring strongly in these slides. However, we want to bring your attention to Westmoreland and St. Anne, where we are gradually starting to see the filling up of those communities with color right across those parishes. And we want to point out that this represents the fact that we do have community transmission in these parishes, and many times where you're not seeing a shading in may represent the fact that these persons have not presented for testing. But certainly that this shows that in these parishes, in the northern western parishes in particular, we are seeing many, many more communities being affected. This table would represent our top 20 communities with active cases over the last 2 weeks, period November the 25th to December the 9th. And again, you can see featuring heavily is the northern and the western parishes. Here we can see Westmoreland in blue, several communities that are affected, St. James in green, and St. Anne in purple. Those are communities that we are seeing quite a number of communities within those parishes. Would want to bring to your attention that Central Village is at the top of the screen, and that represents a cluster of cases that we are seeing now in one particular entity that our health department is managing, but it represents one cluster of cases. Next slide. Here we look at the number of deaths that we have seen over time, and you would have seen that with the peak in the number of cases that we had in August, gradually going down in September, that would have been the time when we would have seen the largest number of deaths, and we have seen a gradual decline going along with the decline in the overall number of cases. However, now that we are starting to see a rise in the number of cases, we are also seeing a rise in the number of deaths. And so again, the word of caution to all persons that at this time when we're expecting to see the numbers go up, we must make every effort to protect the vulnerable persons, protect the elderly persons, so that we do not see an increase in the number of hospitalizations and the number of deaths. Here we want to depict again that our males are where we're seeing more deaths than in the females, with 150 deaths. Of the 270 deaths that we're reporting now, we have 150 that are male and 120 that are female. And here again to represent, to show that our problem in terms of the severity of illnesses lie in our elderly persons, and certainly over 60 age group, we are seeing an increase in the number of deaths as persons get older. This shows the parish distribution of deaths, and really what I would just want to highlight from this is to say that every parish has been affected, and so there is no community or parish that is exempt from taking all the necessary precautions, because even in the parishes that we have the lowest number of cases being reported now, you will notice that the case fatality rate, which is the number of deaths per confirmed cases, is actually very high. We want to turn our focus to Westmoreland. Our minister would have raised in Parliament the issue that we are facing in Westmoreland, where over the last month we would have seen an increase in the number of confirmed cases, and also an increase in the number of hospitalizations, and also an increase in the number of deaths. And Westmoreland, we have Westmoreland now representing 4.4% of our total confirmed cases, 16.4% of our confirmed cases over the last 2 weeks, and we are having the greatest amount of deaths per population in Westmoreland. This is the epidemiological curve for Westmoreland, and we had pointed this out earlier, where we are seeing a gradual increase in the number of cases. And this would show again the communities that are affected in Westmoreland, and this points heavily to the caution that must be taken at this time by the people in Westmoreland to ensure that they must protect themselves, and they must protect those that are close to them that live in their homes. They must wear their mask at all times. They must exercise physical distancing and practice hand sanitization, hand washing, respiratory etiquette, meaning to cover your coughs and your sneezes. And if you are sick, you must stay home. A lot of the cases that we're seeing in Westmoreland comes out of the contact from the homes of persons who are sick and having symptoms, but we recognize that the persons within their homes are not taking precautions. And so we want to emphasize that sick persons are to stay home and precautions must be taken within the home. And especially at this time as we approach the Christmas season, and you may have family that are visiting, you may have other persons that you are close to coming into your homes. Precautions must be taken in the homes as well to prevent spread of disease. Not because you're at home, you should feel comfortable. Sick persons should stay away from other persons, and all other persons should wear their mask and practice all the infection prevention and control measures. Our next slide just gives us an overview of the communities that are heavily affected, and we want the persons in Westmoreland to pay particular attention in these areas: in Negril, Little London, Grange Hill, Big Bridge, Landio, White House, Frome, Savlamar Business District, Sheffield, Petersfield, Bluefields, Georges Plains. Now, those are where we're seeing the active cases now over the last 2 weeks, and we're asking persons from right across the parish to help us to prevent this from getting out of hand, from getting any worse, from overwhelming our hospitals in the parish. Thank you.
Thank you very much, CMO. And ladies and gentlemen, there you have it. The challenges of this season are already upon us from a public health perspective. COVID is alive. It's raging, more so in some places than others. And the prospects, if we do not take personal responsibility and act in accordance with the protocols that are very established, very clear, the prospects of the season and the new year 2021 could be as worrying as we have had to deal with in 2020. And believe me when I say to you, the team here in public health, the government by extension, all public health workers across the country would much prefer to see us start 2021 looking up and looking forward to the silver lining on the horizon, which is to see the vaccine and to occupy our time with administering the vaccine than to be dealing with overwhelmed hospitals, death, and all the pain and suffering that comes with it. Christmas is a time for sharing. It's a time for caring. It's a time for giving thanks. It's a time for rest and relaxation, merrymaking. And we understand that that is a tradition, but this is not the ordinary, the typical Christmas season. This is an extraordinary Christmas season because the circumstances are extraordinary, as reflected by the COVID advisories that we have given out. And we are not alone in that regard. It's a world issue. The numbers in North America are up and expanding. In Europe, we really are trying to manage the process here. And frankly speaking, we have done fairly well to date. For the most part, Jamaicans have cooperated. We have tried to balance lives with livelihood. But we know it's difficult. We know it's difficult because there's a natural tendency for the season to do certain things. And there's also the natural tendency from a commercial standpoint to maximize returns by, the commerce and all the related business activities around that. But it is so important that we do not enjoy the season at the expense of COVID expanding going in the new year. Westmoreland, the CMO has said, and we have said before, is a challenge, and there's a lot that we need to do. The word on the ground, the reports from all the critical stakeholder bodies, not just public health workers, by the way, they are required to report back, but from the hospitals, in terms of occupancy, or persons demanding hospital care, from the police or constabulary who helps with enforcement, is that too many of our citizens or residents in these areas are not considering the protocols. They're not wearing the masks. They're still having the parties. They're still moving around and congregating beyond the 15 maximum that is required. And as a consequence, they're spreading the virus. And it is not a good thing for all sorts of reasons. It's going to see deaths going up and the surge continue. And, we are an interconnected country, so we are linked. So I want to just say, wear your mask, maintain your physical distance, wash your hands, abide by the quarantine rules, because this is all in our best interest. The campaign that we have launched, Mask Up Before You Talk Up, I want to encourage us to please let us abide by that rule, because we understand that in some instances it's very difficult to social distance, particularly in the town centers, in the commercial district. But sanitize as much as you can and mask up. Make the mask wearing the one very standard feature of all that you do this Christmas. It is so important. Now, our municipal authorities play a very important role during this festive season. I mean, they play an important role normally anyway, but we thought that so close to the season, we should give them an opportunity to have a conversation around what they're doing in their respective jurisdictions, in their parishes. And we thought it was important to start with Westmoreland, because the mayor there, Councillor Bertel Moore, mayor of Sabadell-Mar, is, I know, having to deal with his councillors and his administrative team what is happening in the parish of Westmoreland, managing the commercial districts, addressing the protocols that are necessary while looking at the events that are taking place, coordinating with the police. The local municipal authorities are very important. So do we have Mayor Moore online?
Hello.
Councillor, how are you, sir?
Hello.
His Worship, are you hearing me?
Yeah, I'm hearing you now. I wasn't hearing you a minute ago.
Okay, well, listen, happy to have you on, and I know you're all the way in.
Who is
This is
Minister Tufton?
Yes, same one.
Oh, it's a pleasure, sir.
Same here. Thank you for joining us on COVID Conversations. Have a quick conversation with you, just to ask you. You would have heard the announcements around Westmoreland and the COVID cases. Wanted to get from you what your take is on what is happening in the parish, in your town, and why you think we may be having this surge in the first instance.
Thank you very much, Minister Tufton. Well, there are certain things that is happening which I think is playing a role in the situation here. I was very alarmed when I hear of the numbers, but I think we have to clamp down more on these parties that are taking place, because I think that's one of the problems in the parish. I had discussion just today at our council meeting with the Deputy Superintendent of Police, and they said they are trying to play their part, but it's not easy. I think they need more assistance, to be frank. And I also had discussion with the MO8 for the parish today. And we are planning, they are doing testing all over the parish at the present. As of tomorrow, I'm supposed to be having a discussion with SDC, because we want to do a announcement with a car going around and announcing the situation, because right now we are faced with two different things. We are faced with COVID and we are faced with dengue. And we have to try in every way we can to see how we can curb these things. I am getting good support from the police, which I'm very happy to say. And also the health department, the frontline workers, they are trying their best. But what I'm seeing, it's not satisfactory to me, the amount of cases we are having in the parish. So we ought to do something.
So I was actually in the parish a few weeks ago, and I intend to be back there this weekend into next week. in Little London, where we did 120, I think, tests in that area.
Right.
And the positivity rate was like 15% or thereabouts.
16%, to be frank, 16%.
Why? And
Little London was 18%.
Which is probably twice or more what the national average is.
Exactly.
What is it that you think is worship? Why is it that people are refusing, or some persons at least, to obey the protocols? Is it that they're not hearing it enough, or they're just not taking it seriously? What do you think?
Minister, I think they are not taking it seriously, and they don't know how serious this COVID situation is. It is very serious, and it's just keep going up and up and up in the parish. We have to take some drastic measures to really let them understand.
Well,
yes, sir.
Well, I hear the passion in your voice, the frustration too, and I really want to express our appreciation to you for the efforts at the level of the municipal authority, in conjunction, of course, with the health department and the police. We're going to be back in the parish, and know the team on the ground are working hard. And
they are. I can tell you that.
There are a series of measures that are planned.
Dr. Graham, Dr. Graham, Mr. Morris, the whole team, Miss, what's her name, Hari, the whole team. They are working very hard in the parish.
Okay.
But it's just getting away from us.
What about permits? Permits for activities?
Minister, we have not given out one permit for months now. Months upon months upon months. Since COVID came in, we have not issued one permit. Not one single one.
But events continue.
Exactly so, sir.
But
exactly so.
Councillor, they say who can hear will feel, and that's not a mantra I want to promote, because I want all of us to hear. And unfortunately, those who obey, if others don't, then they can transmit the disease, the virus, from one to the next. But we want to encourage you, sir. Continue the efforts. We have some particular initiatives that we're going to be launching. The police is going to be stepping up its enforcement, and I want all citizens to appreciate why it's going to be necessary to detain some persons if necessary. And I must say to you, sir, that we may need to tighten the restrictions in the parish at this rate.
At this rate, right.
But
as I said, the deputy superintendent of police was with us for quite a while today, and he spoke on the situation for a good time. And at the same time, we were broadcasting live on a radio station that covers St. James and over Westmoreland and St. Elizabeth and a part of Manchester. And I just pray and hope that the citizens will hear and understand and know what they are supposed to be doing so that we can curb the COVID situation.
Your Worship, thank you very much for joining us, and please stay safe.
It's a pleasure.
And all the best. And hopefully I'll see you. I may see you on Sunday at a meeting of the hoteliers and the Chamber of Commerce in Negril. So we'll be in touch. Thank you.
Just let me know and I'll be there.
Okay, all the best.
Okay, Minister. Take care. All the best.
You know, while we get the next chairperson of in this instance, the St. Anne Municipal Authority, Councillor Sidney Stewart, I think it's important to say that we fully understand why, persons will want to earn as much as possible during the festive season, because it's what, livelihood is very important. I mean, sometimes when you talk to the vendors, the shopkeepers, the commercial district is normally a buzz. It represents a fairly large chunk of business during any particular year. They sell more during this period. And I know it's very difficult to ignore the need to try and make as much as possible. So from a business perspective, it is very understandable, and we have to show some empathy and understanding around that. The question is, can we do it and do it in a way that is safe for those who are sellers and those who are buyers? And that's one of the things I'd like to ask Councillor Stewart, or His Worship the Mayor Stewart, as it relates to the council and its governance of the commercial district. CMO, what would you recommend to persons who are involved in the commercial districts, both as buyers and sellers, just to ensure that we try to protect ourselves while doing an activity which one can understand would be more so in this time of year than normal?
Minister, I would say that for the business owners, they need to, we certainly don't want them to be earning less, but we believe that if we do a little bit more planning in terms of trying to attract persons into the business places in what normally are the downtimes, so that we spread out the number of persons and therefore decrease the crowding within business places. I think if we can put in some incentives to persons to come into the stores at these downtimes to be able to purchase, we need to ensure that persons are sticking to the infection prevention and control measures. We need to advertise that our business place is safe so that persons feel safe to come out and come to your business place, and that they can tell other persons that when I went to this place, they had all the protocols in place and you should feel safe to go there. I think persons should want that to happen. If we promote the businesses that are doing what they're supposed to do, then we should get more persons coming to those, and other businesses would also may want to be doing that. I think also that whatever measures in terms of the encouraging persons to use a delivery service to prevent persons from actually coming into a store, if they can call and make an order, if whatever you can do to shorten the interaction within the business place is also a good idea. So business owners need to start thinking creatively. I'm sure they're doing that already, but they need to go the extra mile to see how it is that they can decrease the contact, because the fact is that if your customers get sick, then you're going to lose out in the long run.
Right. Thank you very much for that, CMO. Wise words. So we now have online His Worship the Mayor of St. Ann, Councillor Sidney Stewart. Councillor, His Worship, welcome.
Minister, how are you? You have my regards, sir.
Thank you very much for joining us. How is your parish, St. Ann, and how is Ocherios, the town?
Okay. Good evening to everyone. I hasten to point out, Minister, that we were in and we got disturbed with the internet system. We're trying hard to come back in and we're still failing where that is concerned. But in relation to the parish of St. Ann, it is, I want to give you a perspective of what normally happens and then what our involvement in the exercise are up to date. Well, in St. Ann, it is customary that the activities are done in large numbers. The three major towns are normally infested when it comes starting from the market up into Christmas Day and thereafter. Now, that is the usual practice. And then the municipality normally make arrangements in diverting the traffic, so we allow the social activities are concerned and the jollification for a period. Now everything has changed in relation to trying to reduce the number of people that would be gathering in the major towns. So what our involvements are? We're starting our campaign by using public address systems right across the parish, and encouraging the people that if you have to leave home, you must wear a mask. Well, if you're taking the kids with you, they must be wearing a mask. We are meeting with the business people, not in large groups, but one by one, to encourage them that they must follow the protocols and they must have additional sanitization stations in place. All workers, all managers, all owners of establishments must be wearing masks. any members of the public going in and out to do business by way of purchasing must be wearing a mask and they must be sanitized while going in. We continue with the non-issuing of permits for public sessions. None of that is allowed, even though there are people out there today who are still breaking the laws. And I want to commend the police in St. Anne, because I know that they're working extra hours to ensure that they can put that under control. We are encouraging the entire public not to have large gatherings. So, of course, the question of funerals and so forth, they must abide by the protocol numbers. Now, we had a meeting today where the Ministry of Health personnel gave us some perspective in terms of the spike, and we looked at the graph. We had a meeting with the police last week where we are going to be allowing something, because the regular market hours for food vending, well, we'll go on, because that is an activity where, while you say to them in the market, you must maintain a distance, and you say to the people who comes in to do purchasing that we don't want you to come in large groups and you quickly purchase and leave, that goes on. But for Christmas Day, we're making an arrangement where we are diverting the traffic and we are reducing the activities only to 8 hours. Certainly in the past, the town would have been open from Christmas Eve morning and it goes on until Christmas morning the following day. Well, we take into consideration, we take note of the fact of the curfew hours that is primary, and we take note of the fact that we are trying to force the people to desist from gathering beyond. So we're going to be giving them some permission between the hours of 2 and 9, 2 p.m. up until 9 p.m. And we're working with the police on that. The police and us will be jointly going through the entire day doing the advertisement, reminding them that you must abide by this protocol, and your cutoff point is 9 o'clock, where all the customers and vendors must be out of the major towns, out of the town square, out of the community square, and be inside their home before the curfew starts. So we've been doing these things. Now, we had a meeting yesterday, and the Ministry of Local Government and, of course, our Honorable Minister is insisting, and we put a number of measures in place also. So we were offered yesterday a number of sanitization machines from Digicel that we will be putting in addition into the major towns also. And our meeting today has determined where those locations may be. We don't know what numbers we are going to be receiving from that number, because it's 114 parishes. But whatever we get, Minister, we are going to be supplementing them, because all our major towns must be equipped at intervals with all those sanitization machines. So we are imploring on our residents in the parish of St. Anne to take the precautionary measures, to abide by the rules. We are imploring on the business people to act with that level of principle and ensure that the people coming in and out, we are imploring on them to look at the opening hours and the closing hours, and the Ministry of Health is working very well with us. So our campaign begins next week, where we'll be issuing flyers right across the entire parish, flyers that will be infesting the place, telling these people and reminding them what is expected of them, because certainly we don't want to have any additional cases about what we're currently looking at.
Thank you very much, Your Worship. Sounds like you're doing a lot, and I'm very happy to hear the coordination with the police. In fact, yes, I would certainly recommend that all parishes, all capitals, town centers, the police's role, not just in enforcement but in encouragement through the town crier method and so on, is a very good one. I spoke to your Minister of Local Government and Rural Development today, Minister McKenzie, and I know he had the meeting with you guys last evening, and we're working very closely together, and I want to commend him and recognize him for that. But the numbers are still going up, Mayor, and that is the challenge. It's a pity that so much effort is being put out, but some people are still ignoring the rules. But you know, is it that they're not understanding, or why do you suppose people are not obeying the protocols?
I think, Minister, that we initially we were focusing on the town centers, and we were not focusing heavily on the community square. I believe we now need to start placing some emphasis on the community square, because while the town centers are where people come to do shopping and to do commercial activities, so they may come in large numbers, the community square are where people will assemble at a bar, at a shop. These are where they will have their own method of conversation for a period, and they are not taking it as seriously as it existed. So I think that our campaign needs to take us right there into the backyard. And
yes.
That is why we decided that we are going to be distributing flyers like we're doing little booklets all over the place. And we're going to be, if we are campaigning, if we come to your home and you're not there, we slip it under the door. It's not just a reminder, it's a method of instruction to say that this is what we would like you to do to prevent us from having an escalation of the virus as it stands now, because some of us are not taking the virus seriously. And that's why we are not issuing any licensing, any permits, sporting activities, none of that. We were, even our Christmas tree lighting ceremony, we're not having any ceremony. We're just going with a pastor and one person. Pastor will bless the tree, we energize it, and we leave.
Your Worship, we're going to have to leave it there because we have one other mayor, the mayor of the KSA, Senator Delroy Williams, to come on. But thank you very much for your intervention, and thank you for the coordinated approach that you have told us about here this evening. And I want to, on your behalf, encourage the citizens of the lovely parish of St. Anne to please continue to observe the protocols, because we really are all in this thing together, and together we can overcome. But if we don't work together, then it could be a challenge going into Christmas and the New Year. Thank you, and all the best, and keep safe. I'll see you sometime next week. All the best. Okay, you know, there you have it again, a conversation with the mayor of St. Anne, Ocho Rios, and its environs. And his essential message is one, from my point of view, is that we have to work together in terms of agencies, and clearly there is efforts there with the police, with the health department as usual. And secondly, it's important that in pushing that message, it's not just confined to the capital or the main towns, but we have to go out in the communities. And that's what the concept of the community health aides are. They go out into those communities, into the housing development, into the smaller towns, and they play an important role in just bringing that message. Today, I spent some time downtown Kingston, right in the heart of the shopping district. And I tell you, His Worship the Mayor, Mayor Senator Delroy Williams, Councillor Senator Delroy Williams, is and his team. We were there with two other councillors, Carrie Douglas and young Dwayne Smith, and his team. We walked the location. We handed out masks and sanitizers and pamphlets with probably 100 or so community health aides, the public health team, as part of our Mask Up Before We Talk Up campaign. Now, His Worship, you have probably one of the, first of all, welcome to COVID Conversations. You have probably one of the toughest tasks during this time of year. I don't know how you do it, but I guess we all have our burdens to bear. What's your sense of the major commercial districts, downtown being the most significant during this season as it relates to the COVID sensitization?
Well, the as you know, very early on, the market district was highly sensitized, so we applied various measures. I mean, the Ministry of Health had also helped us. And so they were sensitized earlier on. I think that you have somewhere in the middle there was kind of a relaxation. What we have done, we have stepped up our PR and public sensitization program. I know you have been doing the Ministry of Health and Wellness doing a lot of work in urban centers. So we have basically been organizing, been sensitizing. We will continue the issuance of masks throughout the festive season and sanitizers. And we have also added some personnel in terms of municipal security to help maintain the order there. So, and then, there is the order itself with the curfew hours, social distancing. So as much, we are trying our best as possible to ensure that all the measures are in place and that the vendors stick to them.
What is the compliance like in your view, based on your team on the ground and the feedback that you're getting?
I would say, if I were to be honest, I sense even in my walk today there is some level. You see the mask wearing and you see vendors wearing it, but then you see across also you see some persons just not. But generally all persons have masks. I observe that. Some at times not wearing it, but when you ask, they take it out at the same time.
Right.
So the mask, they have the mask, but I think we have to step up the sensitization so that we get as much of them wearing it as possible. And today I observed some distancing. It's downtown, it's the market district, it has a culture of being crowded. Today I sense some distancing, and so I believe people are still very conscious of the measures and in terms of social distancing, wearing masks. But I think we have to just do some more work to keep it active and keep it on the forefront of their minds.
One of the interesting things that I observed today while we walked downtown was that, as you correctly pointed out, most persons have a mask. The question is where the mask is. It's not always on their faces. It's in the pocket. It's in the handbag. When you say, what happened to your mask?
Side of a tie.
Yeah, right.
Yeah.
They go in the pocket and they pull it out, and you have to ask them the question, what use is it to you if it's in the pocket? Now, I wonder, though, Your Worship, whether or not some walking town criers, because the district is so crowded that you really can't even drive through in some instances, but maybe some guys with bullhorns that just walk through and just keep reminding people that you must wear the mask because, they know, but unless they are constantly reminded. I don't know what your thoughts are on that.
No, I'm glad you
there's
mentioned
anything.
it because today early we had a meeting this morning discussing it, and that was one of the suggestions that we would have that, not only for reminding them, but for in terms of the mask, but also for when you get closer to the curfew hour, that we will begin to alert them also in terms of for them to begin to pack up so that they are not there during the curfew hour.
Right.
So it's a good idea, and it's something we thought about today, and we will do.
The final thing I want you to discuss with you, your council has been placed on flyers. The minister raised it in Parliament of granting permits for activity, and I think it may be important for you to clarify this issue of the municipal authority, KSA, granting permits, and whether you are granting permits and what the policy is as it relates to these activities during the season.
I believe it was as far back as it was March or late March or early April when the government said that there would be no issuance, and we had rescinded licenses that we had already granted. That since March, April, the KSAMC has not been granting licenses for events of that nature. So our position is very clear. We are not granting any amusement licenses. So there shouldn't be any partying across the municipality. If you see any, they have not received a license. So because we are not granting licenses. and our position is very clear on the matter.
And as the mayor with the largest jurisdiction to preside over, which comprises a large percentage of our population, what final advice would you give to the citizens of your jurisdiction as it relates, particularly those in the commercial spaces?
Well, I would ask them to. I mean, I believe we have been doing a good job so far. I mean, there have been issues, but we have worked together to iron those issues out. It requires consistency. I believe that we have been doing well as a government and as a municipality, and I want us to just continue to work together. Just keep very focused on the orders, on the protocols, the social distancing, the wearing of your mask, and the use of sanitizers, and the practice of washing hands as often as you can. We just ask the vendors and the persons using the urban spaces to be alert and to be very conscious of what the measures are and don't relax. This is not a time to relax. We will get past this, and getting past it is coming soon, I believe. But let's be very aggressive in terms of how we respond to the pandemic and continue to respond.
Your Worship, thank you very much for participating in this COVID conversation. Thanks a lot for hosting today, and we look forward to the continued close relationship as we work together to overcome the COVID threat that we face. Thank you, and keep safe. All the best.
And thanks very much to you and the leadership you and your team provided.
Thank you. All the best. So the issue of the business districts and the commercial activities that are taking place, to be totally sort of open and frank about it, is that businesses are important to the life of any society, any community. And we don't want the impression to be created that we're beating up on businesses or beating up on entrepreneurship or entrepreneurs and destroying opportunities that clearly are important, both from an employment perspective but also just from economic activity perspective. But it really becomes a balance. It really becomes, how do we manage the process to allow economic activity to continue while we safeguard our population against COVID-19. The private sector bodies, and the umbrella body being the PSOJ, Private Sector Organization of Jamaica, its recently re-elected president, Mr. Keith Duncan, is online to hear from him and to tell us exactly how the private sector is positioning itself going into this season. We know it's a busy season for the private sector, and also the role that they have been playing and they would like to continue to play as part of the COVID response. President Duncan, welcome to COVID Conversation, sir.
Thank you, Minister Tufton.
Right. Well, we're happy to have you. This is not, I think this is the second or third appearance, but the first since your re-election.
Yes, sir.
Okay, and I understand that you won by a landslide, like previous elections. Is that so?
That is true. That is true. I had no.
Anyway, listen, we understand the challenges of the private sector. We really do, and at times we may appear to be talking at cross purposes because clearly, COVID restrictions means restrictions on business, and we know the challenges there. But you have been a good partner, and your leadership and your organization has offered a lot to date. And I understand that you're offering even more. I'm going to ask you to tell us a little about the extra offerings, masks and sanitizing stations. But give us your perspective on how you see the season based on all that you have heard and what you think the role of the private sector is or should be.
Thank you, Minister Tufton. And firstly, let me just acknowledge the efforts of the Ministry of Health and Wellness, the CMO and her team, and yourself, Minister Tufton, for your leadership. It has been a real effort to really find that balance between economic activity and public health. And working along with the Ministry of Health and Wellness, we have had a very constructive, I would say, relationship to date, along with other private sector bodies, in trying to find that balance to ensure that we can save lives. We can manage to ensure that we can manage the capacity and the resources of our public health system. There have been some lively discussions, and sometimes the CMO have to really put down our foot on us, and we have to say, okay, ma'am, you know what I mean? But it has been a very, very open and productive relationship. I think Jamaica has done even better than our peers in terms of finding that balance between the economic activity and public health. And I must just acknowledge the team and yourself, Minister Tufton, for that. In terms of us going forward, I mean, the PSOJ from the outset of the pandemic has been very, very involved in this whole effort of finding that balance, you know, in terms of developing the protocols through a local services committee on the COVID Economic Recovery Task Force team. And we have also been able to raise funds for ventilators, in raising about $150 million for ventilators, testing kits, and PPE. And also, working with the Diabetes Association of Jamaica as we roll out care packages across the island into over 60 communities, and doing tests for people for underlying conditions, etc. So we have been quite active in working in partnership with the Ministry of Health and Wellness and the government of Jamaica. And we continue with that partnership because we know it's important, because we know we have limited resources. We know that the public health system has limited capacity, beds, medication, and otherwise. And we intend to continue that relationship. Now, we have been working along with the CMO and Dr. Spence in terms of a whole partnership around how do we communicate and have our team members, because our private sector in terms of the manufacturers, tourism, retail, business process outsourcing, etc., everybody has done well in terms of putting in place the protocols and being disciplined around it. Now, it's the team members and the employees that we want to go out back into their homes, into their communities, to ensure that they spread the word and that they hold their communities accountable, being ambassadors almost. And the Jamaica Hotel and Tourist Association has been at the forefront of this with an ambassador program. But we are working with the Human Resource Management Association of Jamaica, the Ministry of Health and Wellness, to get that communication out through employees into the communities. That's an ongoing effort. And going into the Christmas season, we're continuing to sensitize our members as to ensure that they maintain the protocols. Now, I heard the CMO speak about some creative solutions that we can look to employ going into the season, and we look to take that message out also in going forward. But on a level of in terms of what we'll be doing for the Christmas season, well, we'll be working in terms of donating wash stands across the island into 18 wash stands across the island into various communities. Kingston, St. James, St. Catherine, one for each parish. We'll be donating over 3,000 masks. And most importantly, on the request of the CMO, we will be working and supporting the Jamaica Chamber of Commerce and the All Island Chamber in bringing cheer to the hospitals, in Christmas decorations for the hospitals across the island, to ensure that our public health people who are in there working hard every day under immense pressure, that we can at least bring some good cheer. And that was on a request of the CMO. And CMO, we're giving you a Christmas gift, ma'am. So we will continue to make the effort to work. And Janet Silvera, we just agreed that she will do the who is online, president of the Mobile Chamber of Commerce, that she will do the pediatric unit and the emergency A&E unit in Mobile. So therefore, we are fully supportive and fully behind the public health team, and we are definitely working with our members and our employees to get out there, spread the word, hold our people accountable, because if we limit the spread of the virus, then we can increase economic activity. And I think that's what everyone wants. Everyone wants to have that livelihood that they can earn and they can support. And we're encouraging wider Jamaica to just be disciplined around the infection control protocol. Wear your mask, sanitize, socially distance. Let's keep it up as quiet a Christmas as possible, so that we can ensure that we go into 2021 in a really, really in a good place, in a much better place so our children can return to school. And you know, we can leave 2020 behind, you know. So
thank you.
That's where we are right now.
Thank you very much, President Keith Duncan of the Private Sector Organization of Jamaica. You've said a lot, but all valuable information in terms of the role that you're playing, the role that you'll continue to play. Really want to say thanks on behalf of the public health system for the efforts at bringing some cheer to the frontline workers and the public health team generally, because let me tell you, this has been a very testing year for all of us. So we have to ensure that we work together and we provide ongoing encouragement. Of course, you would have heard the numbers increasing in certain areas, Western Jamaica in particular. And, you know, part of the explanation coming from the mayors, the police, is that persons are being creative in having their activities, you know, the parties and so on. I don't think you have a lot of control over those types of activities. I doubt they are members of the PSOJ or the chamber in many instances. But, you know, we understand why persons will be tempted so to do. But again, we have to lend our voices to encouraging persons that are involved in any kind of economic transaction to do so responsibly and do so within the realms or the ambit of the protocols that have been established. And I think your voice and the voice of your respective organizations can assist in that way. I wonder what your opinion is on that.
Oh, most definitely. And I think all of us have been, you know, PSOJ, the JMEA, the Jamaica Chamber of Commerce, the All Island Chamber, the MSME Alliance, Small Business Association. All of us have been really advocating and really working on the ground to ensure that our employees really get that message out there into their communities, because I think the challenge is not in the workplace, it is in the communities, in terms of, you know, their friends, their family, you know, really ensure that they are disciplined to the infection control protocols. And we have been really pushing on that, and the message is that if we can contain the spread of the virus in order to minimize the draw on the limited resources of the public health system and to save lives of our family. I lost my father to COVID.
Yes,
you know,
yes, of course.
And save lives of our family and friends. Then we can, economic activity can increase because we are being disciplined. So if we wear our mask, that in itself it allows for us to be more disciplined, and more of us that wear our mask. It really allows for less pressure on the public health system, and therefore it will, you know, you could even look at possibly lifting some restrictions or extending time if we as a people are disciplined. So we must be disciplined. We must be disciplined. It's not a draconian thing. It is just a way of life in the new normal. Because over the next year or so, as we look to roll out that vaccine to 60% of our population, we're still going to have to be very disciplined. So that meaning that having that vaccine doesn't mean that we must relax. We actually have to become more vigilant if we would like to see more jobs being given back to people, because we can increase economic activity.
You know, Keith, I hear the passion and really appreciate it, and particularly when you mentioned the passing of your dad, someone I knew and respected, and I can understand the pain that you and your family went through. So you speak from first-hand experience. So I really hope that Jamaicans are listening and adhering to the advice that you're offering. So I want to really thank you for coming on. Thanks for the partnership. And as I wish you the best of the season, we will continue to work together to ensure that we encourage the adherence to the protocol as we seek to overcome this public health threat. Thank you very much, and all the best to you. Thank you.
Thanks for having me. Take care. All the best.
So today we're going to be showcasing the communication strategy, or should I say a more elaborate communication strategy around the campaign going into the holiday season. We did say that we were going to increase the activity in both the print and electronic media to encourage Jamaicans to celebrate Christmas, to give thanks for the season, for what it represents, to spend time with close friends and family, but also, very importantly, to recognize the threat of COVID-19 and to take the necessary precautions to protect yourselves, but also those who are close to you. And I want to just, if you focus on the screen, give you a synopsis of what is in store in terms of the work that has been done by the ministry to keep the public informed.
It's the time of year when we spread love and good cheer, but Christmas is not cancelled even though COVID is here. 'Cause this is Christmas, but stay 6 feet away. Oh yes, we have curfew, but we not feel no way. Sanitize every day, protect your family, and when you touch the road, connect responsibly.
Chad save, wear your mask, keep your distance 6 feet when you talk. If you're not happy, go road, stay home.
Sanitize your hands, 'cause this is Christmas, but stay 6 feet away. Oh yes, we have curfew, but we not feel no way. Sanitize every day, protect your family, and when you touch the road, connect responsibly.
A message from the Ministry of Health and Wellness.
Social distancing. Ching. It's a must. World of rock. Me I gonna be real with it. When I travel, you must quarantine. Please remember, wash your hands clean. 6 feet apart, distance with the team. Sanitize your place to stay clean. Where's your mask? Wear your mask. Where's your mask? Wear your mask. Where's your mask? Wear your mask. Now if you try destroy the world, everybody know. Wash your hand now. Wear a mask. Sanitize social distance now. Wash your hand now. Wear a mask. If you try destroy the world, everybody know. Cha-ching. Ching speaking, I'm gonna be real with it. When you travel, remember you must quarantine. Wash your hands, wear a mask, and stay sanitized. And your area must be clean. Ching! COVID-19 still alive. Must get you feeling fine.
COVID-19 is still here. Think twice before you touch the road.
Turn on your yard and feel the vibes.
Yes, enjoy, have fun, but remember, do it responsibly. Stay home, wear your mask, sanitize, keep your distance.
An important message from the Ministry of Health and Wellness.
It's a season to share love and joy with friends and family, and we want you to stay healthy while doing it. Don't forget, COVID-19 is still here, so connect safe, stay home, sanitize, keep your distance. COVID-19 still a keep. Have a healthy Merry Christmas. Stay home, stay safe.
An important message from the Ministry of Health and Wellness.
Must get you COVID-19 still alive. Must get you feeling fine.
COVID-19 is still here. Think twice before you touch the road.
Turn on your yard and feel the vibes.
Yes, enjoy, have fun, but remember, do it responsibly. Stay home, wear your mask, sanitize, keep your distance.
An important message from the Ministry of Health and Wellness.
Okay, thank you very much. So there you have it. We saw some, we heard some radio ads, some noted the DJ, Ching Ching, and I'm not sure who the other person was, but I at least recognize one, right? Who? Ashe, okay. That's a group. And then we had a few print ads showing the family environment and the messaging around that. And then we saw a couple of TV ads. I understand that there may be one or two more to come. But starting when will we start airing? Tomorrow. So starting tomorrow, we will hear all of these on the air in one way, shape, or form. And it really is about encouraging, motivating, and, getting persons to continue to observe the message of Christmas, the meaning of Christmas, but at the same time observing the protocols. So thanks to the team for that, and we will hear more about those in the days and weeks to come. That's it. Let me hand over now to Stephen for any questions.
Thank you very much, Minister. We're going to remind our media colleagues to use the raised hand feature on Zoom if they have questions to ask. We're going to begin with Janet Silvera from The Gleaner.
Thank you. Good evening. My questions are, what is the reason for the high number of deaths, the 32 that I've heard on the investigation? Is contact tracing a part of the reason? What are the challenges that you're experiencing with contact tracing, and are there enough persons assigned to carry it out?
I just want to say that the 31 cases that you see on the investigation are not necessarily the same 31 that has been there all the time, because as cases are classified and new cases are added, then they go into the under investigation group. We do have to wait on the hospitals and the facilities to provide the information as to the cause of death. Sometimes we have to review the case notes. We have to do some other investigation to ensure that the death is classified appropriately. So though you see the same 31 number in terms of a number written down, it is not that it is the same 31 persons that are continuously there. We are adding, but we're subtracting as well. But it does take us a little while to get all the information in to do an appropriate classification. In terms of the contact tracing, we continue to do our contact tracing. What we do have problems with at times is the supply of information on the lab forms. And if it is, we want to encourage persons that at all times the forms are filled out properly, including the addresses and the contact information of persons, so that we can make contact with them. We know what are the addresses to go to in case we don't have a telephone number. And also the reason why the test is being done, because if it is labeled that we know that there are contacts or whether there are new cases, then it helps also in terms of the classification of cases. Thank you.
Thank you very much, CMO. We're going to go to Brittany Clark from Nationwide.
Okay, good evening, everyone. CMO, I have a question for you. Earlier, you mentioned briefly the case fatality rate. I just wanted to know if it's possible for you to comment further on the rate here in Jamaica with regards to how it compares to the rate of the region and the United States. Yes, thank you.
I don't have at this time the case fatality rate for the region. In terms of our case fatality rate, I'm looking for the exact number. I don't have it right here in the paper that I have, but I believe that is about 2.3% is our case fatality rate, which is the number of deaths with the denominator being the number of confirmed cases. So if you work it out and it's not 2.3, it should be around there. So I don't have the exact number for the regions and for our other Caribbean neighbors, but the last time we had looked at it, we were not faring badly in terms of comparison to the region as well as comparison to the world. Maybe at another time I can comment on the exact numbers.
All right. Thank you very much, CMO. There was a third question from Janet Silvera. She was asking if there are enough persons assigned to carry out contact tracing.
Right. Well, when you ask if there are enough persons, you can always have more. But remember that we have increased our capacity quite significantly in terms of the over 1,000 community health aides that we would have boosted the community health team. The team comprises the medical officers of health, the public health nurses, a variety of community health workers, including our public health inspectors, our contact investigators. Many persons are drawn into that team for contact tracing. So we would have boosted the numbers with the community health aides that we would have added, and that would have improved our ability quite significantly. But as I said, you can always do with more. But right now, we are able to do contact tracing right across the country.
Thank you very much, CMO. We're going to go to Cassius Watson from Jamaica Social.
Hey, good evening, guys. Are you hearing me?
Yes, go ahead, please.
Okay. Two questions. One regarding, this is a question that was asked of the CMO many months ago. She did promise to get back to us or give us an idea of what the situation was, but it is regarding those who go inside the ICU. What percentage of those in the ICU are coming out fully recovered? Can you give us an idea of what percentage that is? Because many feel that once you go to the ICU, you're done for, that's it. I think Jamaicans need to have a picture of what's happening in the ICU regarding recoveries, if any, and how people are doing there. The other question is for the Minister. Your thoughts on, now that we have recoveries surpassing active cases, we're now at 7,552 at last count. Active cases 3,497. Your thoughts on encouraging? How do you feel things are going for the nation right now?
Okay, I'll allow the CMO some time to check her numbers. It's every recovered case is encouraging, and it's good news for us, as I am sure it is for the individual involved and their families and friends. And it's good that we're now more recoveries than active cases. So we celebrate that each day and we give thanks for that. On the other hand, we also continue to monitor not just cases, but hospitalizations and deaths and where the trend is going. And as you would have heard this past week on Tuesday in the Parliament, and since that time up to this afternoon today, we are concerned that the cases are going up particularly in certain parts of the country, and that is leading to more hospitalizations and more deaths. So while we are encouraged and we believe that we have been working and seeing the results, and we, in a very broadest general sense, we are concerned about any new cases and in particular hospitalizations and deaths, and it's not going in the direction that we'd like to see it go as of now. And that's why it's so important for us to encourage, advise, motivate, warn persons about the season to avoid this becoming a major surge come New Year. Okay, Semo is checking on the numbers for you. Let me, Stephen, you want to go with another question and then she'll come in?
Sure, we're going to go to Owen Brown from Roots FM.
Yeah, good afternoon. Yes, good evening, rather. Yes, it's regarding the information I saw on the graph. I saw where Spanish Town, with active cases, there was a red, actually at the top of the list. Is there anything, or is the ministry looking on any special provision for that area, or is it any concern at all? Because I'm hearing a lot about the West. And two, regarding the vaccines, and the minister said in Parliament on Tuesday that 16% of the population should be vaccinated within the year, and the percentage was given, a breakdown of the percentage was also given. Is the ministry looking on now how more countries are approving vaccines? Is the ministry looking on a higher number when it comes down to persons being vaccinated?
All right, so while CMO gets her numbers, let me just say quickly that the Spanish Town, I think if you looked across the chart, you saw where Central Village was singled out as the primary source of the numbers, and the CMO did speak to that, indicating that there was a particular situation there. The interventions continue across the country. There's no community that is left out. We have a national spread, and we have added significant more numbers through the community health aides. So yes, there is always going to be a response, an intervention, if you will, to where you have these concerns. And if it's an institution or a particularly narrowly geographic area, then we go in and we do the assessment and we cauterize as best as possible. In terms of the vaccine, the announcement is a function of the arrangements that we have subscribed to, which is a COVAX arrangement, which involves 168 countries, and which has, through the coordinating agency PAHO WHO, we have a certain sort of relatively accurate forecasting of what we expect based on when the vaccine becomes available. And from there, we are in a queue to get the allocation as outlined by myself in the Parliament. Now, the truth is things can change. So it's a relatively conservative estimate. Next year, you may find that instead of 2 or 3 vaccines on the market, you have 5 or 6, and production levels could increase, and you may see a lot more being available, and therefore we can do better than initially forecasted or projected. We hope for that. That is entirely possible, but until then, we have to stick to giving a commitment based on what we think is the most realistic expectation, and that's really where we are. We're working with the team locally through the commission that was established and the working group that does the work on the ground, as well as with PAHO. We actually had a meeting today with PAHO, a number of the member states, and we discussed, among other things, the vaccine and some of the issues around that. So the work continues and will continue until we have the vaccine in hand, and even from there we will have to manage the execution of deployment. CMO, you want to respond to the question or add anything else?
I really don't have the figures. I remember you asking the question, and we did prepare a presentation. I've been looking frantically to find it to be able to give you the numbers. So I'm going to have to defer, have to ask Mr. Davidson to ensure that we follow up on that, to provide you with that information. What I do want to say, though, concerning that is that we have patients that are moving between different areas. So we have persons that will come in first as moderately ill, and they may move up to being severely ill, may end up being ventilated, and may have a bad outcome, meaning that they die. But we do have several persons as well that would have go in the reverse direction, meaning that they would have been placed on a ventilator, would have stepped down to being taken off the ventilator, then going into moderately ill classification and then recovering. So we do have several patients like that have recovered. But I do understand that you want to know the numbers, and we will provide that. I'm going to ask Mr. Davidson to follow up on that so that you can get the response to that.
Thank you very much, CMO. Those are the questions that
St. Catherine. Right. So we do recognize that there was a message that was sent out by the Observer or the Gleaner? The Gleaner commenting on the cases in Central Village. On the community chart that we had put up, at the very top of the chart, we had Central Village that was having the highest number of cases, and we would have had there 33 cases, and they were in red. So we have a cluster of cases in Central Village at this time that we are working with the entity to get that under control. So it is referring to one cluster of cases within one facility. So we will provide a release on that very shortly in terms of how we're managing that cluster.
All right. Thank you very much, CMO. And Minister, that's all the questions we have on Zoom. I'll hand over to you for your closing remarks.
Right. So thank you very much, Steve, and thanks to the team, the Permanent Secretary and the CMO, and the supporting team members, some of whom are normally on the program, Dr. Webster Carr, our Chief Epidemiologist, Dr. Hamilton at the Public Health Lab, and others who have played an important role during the course of 2020 to lead the charge. There are so many persons to thank for the efforts that they have put out to ensure that these COVID conversations continue almost on a weekly basis. It is an important part of what we thought was the COVID response, because for us, transparency, providing the information, accommodating understanding, providing the media with access, it was absolutely and remains absolutely critical to overcoming some of the fears and uncertainties, and importantly, mobilizing the population behind the response to this COVID pandemic. So COVID conversations for us has been an important tool to reach out and to communicate. We don't always get it right, but that's the nature of what we do. It's a novel scenario that we're facing, and we have had to estimate and guesstimate in terms of some of the issues, then recalibrate based on forecasting and margins of errors. But I think, generally speaking, based on the feedback, we have been able to provide a forum for persons to come and to hear and to ask questions and to have clarity. So I really want to use the opportunity, this being the last conversation for 2020, to say a big thank you to all who have made this possible. To the team at the ministry, and the two senior team members are here, the Permanent Secretary, Mr. Dunstan Bryan, and the CMO, Dr. Jacquiline Bisasor McKenzie. To the PR team, Stephen, whose voice you hear most Thursdays, and he leads a small team at the ministry's head office. To the technical team, and I have to big up Phase 3. They have become a part of the public health infrastructure over the past number of months. A couple of familiar faces, but sometimes they change from time to time. And they always wear their masks and are always technically on top of their game to ensure that the information is provided. So I want to just big up Phase 3 for the work. I want to thank Tony. Everybody knows Tony, right? Her face is always on the screen, providing the information to a community that is very special, very important, and needs to be kept informed. Tony, thank you very much for all that you do, and we certainly wish you all the best for the season. And to our guests who have been on periodically, the people we interview the persons who prepare the documentation, the information, because COVID Conversations is about everybody, really, literally, everybody being a part of the conversation around COVID. That's really what it's all about. And we've had everyone from the private sector represented to the civil society, to experts of one form or another, to PAHO, to the university community, research community, or to the common man, the recovering COVID patient, who have all given an account of what COVID has been and meant to them and their own role in overcoming the challenges around COVID. And we want to say a big thank you to them who have been a part of this. So for us, it is about how do we complete 2020? How do we get to January 1st, 2021? Our wish is that we all survive, that we all make it, that we spend some time to give thanks for 2020, despite the challenges. We have become only more resilient as a result of the challenges, that we reach out to someone or some persons to give critical support, maybe just a listening ear, maybe just some encouragement, that we find some time to relax. I can't recall taking some time off base. Hopefully I can get a couple of days during the holiday season. It's been a tough year. And we renew our efforts and our resolve to overcome the serious challenges around COVID, which I believe next year will represent a big opportunity for us so to do in conjunction with our partners. I think the hope exists for overcoming this public health risk in the new year. It's not going to be easy. It's not going to be immediate based on the timelines that have been given. But I believe if we use 2020 as the learning experience and the teaching moments for the virus, next year we can no longer and should no longer refer to it as a novel virus. It will be a known virus, understanding its challenges and its risks, and also the way to deal with it. So I do anticipate that things will get better next year. To the media, I want to say thanks, because you have helped us to carry the information out there by coming on each week, asking the relevant questions, and then, of course, providing coverage in the respective media, electronic, print, and otherwise. And we could not have done the communications without you. So I want to big up the media houses, all, both traditional and non-traditional, for being a part of this. So thank you very much. Enjoy the season. Do what you must. And CMO, you want to say a few words? Yes, okay. I thought I was on a real roll there, and I was about to end the game, but CMO, go ahead.
Right. So just two comments very quickly. So I did find the information that we had prepared when the question was asked. The question was actually asked in September. So the information that I have really pertains to at that time, on September the 24th, I believe, when we had 5,558 confirmed cases. And at that time, we had 3.3% of cases that were classified as moderately and critically ill. And at that time, we only had 0.35% of our patients who were ventilated. And that number was 20. And that was a cumulative number, not at the time. So up until that time, the 24th of September, we had 20 persons that were ventilated. Now, I just want to say that when persons do reach to the point of ventilation, it does mean that they are critically ill. It's a very small amount of persons that in our setting that do get to that point. And at that point, at that time, we had a high mortality rate in terms of the persons that were ventilated, because of the 20 persons that were ventilated, up to that time we had 14 deaths, which is 70% of the cases. And what it says is that we really don't want to reach to a point where we are ventilating our patients And it's a very, very small percentage of persons that reach to that point. But it's a warning that we want to put out there, that we need to ensure that we protect persons from being exposed, especially the elderly persons and especially the persons with comorbid illnesses. What we can do is to update that information for you to make it relevant to today's date, and we will work on that for you. The second thing that I want to say, we're at the end of the year. We have gone through a very challenging year, and certainly as we approach the Christmas season, we want to thank everybody for those that have responded to the messaging and that have contributed to keeping our numbers down. Within the ministry, I really want to say thank you to the minister who has provided leadership for our efforts and has really become a public health expert. I can't say that too loudly, but anyway, he has really supported what we're doing from the technical side, and we are really grateful, to have the opportunity as technical persons to be able to freely to speak exactly how we see it is, to say it as it is, and to have the support of our minister to represent our voice in all the necessary forums. I want to also say a big thank you to the permanent secretary, who as well has been very, very supportive and, has found, maybe I shouldn't say this publicly, but has found money where there's no money. And really have, the increase in capacity that we have put down as a result of COVID, really and truly, a lot of that has been due to the effort of the permanent secretary. And we're grateful just to have a team like this, both the permanent secretary and the minister, to really support the technical side of things. We would not be here today without these two persons. And personally, I want to say thank you. And on behalf of the country as well, and all the technical persons, I want to say thank you.
Wow, thank you very much, CMO. Really, thanks to you is very obvious. I mean, you've been the real technical mind behind a lot of what has happened with your team. So I want to recognize you and say a big thank you for that. I want to also just take the time to thank the Prime Minister and the Cabinet of Jamaica. Who, the Honorable Prime Minister has been really out front, leading on this, provided guidance, allowed the flexibility, a listening ear. The subcommittee of Cabinet comprising of a number of ministers. I won't go in all of them: local government, foreign affairs, the AG's department, education, tourism, labor, I did say local government. Really, we've spent many hours. If there's any doubt in anybody's mind about the time that the government has spent on this issue. Oh, I should mention finance also, very importantly. There should be none, because we've had meetings from morning till late nights discussing the issues to make decisions, and the Prime Minister has provided excellent leadership on this. So I want to just recognize from Public Health the support of the team, because it is a team effort. And to the frontline workers, you remain our heroes. Thank you very much, and have a good evening. Right, have a good evening, and we're going to say it together. After three, the three of us are going to say thanks to
all the healthcare workers right across the country.
Everywhere.
Thank you.
Thank you very much.
Merry Christmas, everyone.
Thank you.
COVID-19 still active.
COVID-19 is still here. Think twice before you touch the road.
Turn on your yard and feel the vibes.
Yes, enjoy, have fun, but remember, Do it responsibly. Stay home. Wear your mask. Sanitize. Keep your distance.
An important message from the Ministry of Health and Wellness.